Our kidneys are two small but powerful organs located near the middle of our back, just below the rib cage. They might be small, each about the size of a fist, but they play a huge role in keeping us alive and well. Every day, your kidneys filter about 50 gallons of blood, removing waste, toxins, and extra fluids. They help regulate blood pressure, keep bones healthy, and balance chemicals like sodium and potassium. But what happens when the kidneys stop working the way they should? Today, let's talk about kidney failure. What it is, what causes it, how to recognize it, and how it can be treated or even prevented. 1. What is kidney failure? Kidney failure, also known as renal failure, happens when your kidneys lose their ability to filter waste and balance fluids properly. This can happen suddenly, called acute kidney failure, or over time, called chronic kidney disease, CKD, leading to end-stage renal disease, ESRD. In simple terms, when your kidneys fail, dangerous levels of fluid, waste, and electrolytes build up in your body, and that can be life-threatening if not treated. 2. Types of kidney failure. Acute kidney failure. This happens suddenly, within days or weeks, and is usually caused by things like dehydration, severe infections, or certain medications. Sometimes it can be reversed with quick treatment. Chronic kidney disease, CKD. This develops slowly over months or years. It's often caused by diabetes or high blood pressure, and it's more common than many people realize. End-stage renal disease, ESRD. This is the final stage of chronic kidney disease, when the kidneys can no longer function at all. At this point, the person needs dialysis or a kidney transplant to survive. 3. What causes kidney failure? There are many things that can damage the kidneys, but the most common causes include diabetes, type 1 and 2. High blood sugar damages the tiny blood vessels in the kidneys. High blood pressure. Too much pressure over time weakens the blood vessels and affects kidney function. Glomerulonephritis. Inflammation of the kidney's filtering units. Polycystic kidney disease. A genetic condition causing fluid-filled cysts in the kidneys. Infections, blockages, or toxic drug reactions, including overuse of certain painkillers, like ibuprofen, or exposure to heavy metals and toxins. Symptoms of kidney failure. In the early stages, kidney disease often has no symptoms. That's why it's sometimes called a silent disease. But as it progresses, you may notice fatigue or weakness, swelling in the legs, ankles, or face, nausea or vomiting, loss of appetite, trouble concentrating, muscle cramps, dark or foamy urine, shortness of breath from fluid buildup, high blood pressure. By the time symptoms appear, kidney function may already be seriously impaired. 5. How is it diagnosed? Doctors usually perform simple tests, blood tests, especially creatinine and blood urea nitrogen, BUN, which show how well the kidneys are filtering. Urine tests, to detect protein, blood, or waste levels. Imaging scans, like ultrasounds to check for blockages or damage. Kidney biopsy. In some cases, a small sample of kidney tissue is tested. If caught early, kidney damage can be slowed or even stopped. 6. Treatment options. Treatment depends on the cause and stage of the disease, lifestyle and medication. In early stages, managing diabetes, controlling blood pressure, and changing your diet can help. Dialysis. This is a process that filters waste and fluid from the blood when your kidneys can't. It can be done at a clinic or at home. Hemodialysis, using a machine to clean your blood. Peritoneal dialysis, using the lining of your abdomen to filter your blood inside your body. Kidney transplant, replacing the failed kidney with a healthy one from a donor. It offers better quality of life than long-term dialysis, but finding a match can take time. 7. Can kidney failure be prevented? In many cases, yes, especially when it comes to chronic kidney disease. Here are some tips to keep your kidneys healthy. Control your blood sugar if you have diabetes. Manage blood pressure. Ideal levels are usually under 130 over 80 millimeters of mercury. Stay hydrated, but not overhydrated. Avoid excessive use of NSAIDs like ibuprofen or naproxen. Quit smoking. Eat a kidney-friendly diet, low in sodium, processed foods, and added sugars. Get regular checkups, especially if you're at higher risk. Kidney failure can sound scary, but the key is awareness and early action. The kidneys are resilient, but they need your support. Whether it's managing your health today or helping a loved one understand the warning signs, knowledge is power. Remember, you only have 2 kidneys, and they're not easy to replace. Take care of them, and they'll take care of you.